Thank you very much, Dr. Matthew. And indeed, children are our high priority and focus. And so child health in the COVID response is an integral part. And we'll need to ensure that as we look after our children in our quarantine facilities, that stimulation is there. And we also do not make them miss any of the routine services, that they're supposed to have. And this is a reason why we want to thank our team and the Pediatric and Child Health Cluster, the coordinator, for the work they are doing in collaboration with their colleagues at the Zambia National Public Health Institute. Thank you very much. We remain confident that the fight against COVID-19 will be won because of the leadership that we see in the country, the political will from the summit. We remain confident that the community will continue cooperating with the response team, and we are also happy to note the collaboration of the leadership of the religious bodies with government, the leadership of the church mother bodies, the leadership of other religious groupings have collaborated well with government in assuring that all that they are doing is in line with what is provided for in the Public Health Act and the statutory instruments numbers 21 and 22. And this has been the consistent message that we've been getting from His Excellency President Edgar Chagwa Lungu. Today, we report new cases in the country. 6 new cases have been reported in the last 24 hours. And this has been done. These cases were picked through our surveillance and contact tracing. So we did 80 tests yesterday, out of which 6 came out positive, and 2 are women and 4 are men. These cases are coming from Emmasdale, Matero, and Chelstone. Now, the first case is a female worker, health worker, a contact to the confirmed case from Matero, who is 51 years old. And the next one is a 23-year-old female from Chitalu Emmasdale, who is also a contact to a confirmed case. And the third case is a male adult detected through the mass screening that we conducted in Chipata sub-district. The fourth case is a 43-year-old truck driver who comes from Chelstone but was quarantined at the UNZA facility, and a 48-year-old truck driver again quarantined at the UNZA facility, and a 42-year-old truck driver again who was quarantined at the UNZA facility. A cumulative total of COVID cases, the cumulative total of COVID cases now in Zambia stands at 95, including 3 deaths. The number of active cases within our facilities is now 50, with 45 in Lusaka, 4 on the Copper Belt, and 1 in Kabwe. All patients are stable, and we are retesting those that have been there and will be announcing discharges within the next few days. In the targeted community surveillance operation in Makeni, a total of 1,303 cases or persons were screened and tested. The results will be released as the processing is finished. Today, the surveillance team is in Madras and Kamwala for a similar exercise, and they are also focusing on prevention through community sensitization. Other control measures such as disinfection are taking place, and we are collaborating very well with the Association of the Indian Community in the area to do the exercise. Cumulatively, at global level, we have now recorded 3,065,066 cases, with 211 deaths, while 922,828 have recovered. In Africa, we have now reached 34,037 cases, including 1,472 deaths, and so far 10,575 have recovered. In the SADC region, where we represent the Africa Center for Disease Control as a regional hub, we have recorded 5,161 cases with 104 deaths and 1,560 recoveries. Allow me at this point in time to pay tribute to our cooperating partners, both local and international, individual and corporate, who have continued to stand with us to ensure that our mass community screening strategy is successful. We appreciate the various supplies that we have received, including sample collection swabs, test kits, laboratory reagents, personal protective equipment, and logistics. These materials have enhanced our capacity to continue testing for COVID-19 in many parts of the country. I wish to assure you that government is building enough stock, adequate stock or stockpiling to ensure that we have enough to continue the mass screening and community testing. We have upscaled our laboratory capacity by even introducing use of different technology, and within the course of the week our scaled up capacity will be due to introduction of the Gene Expert machine and Cobas machines that uses different technology in order to do the testing, but with similar accuracy as the PCR. Countrymen and women, I would like to conclude today's update by wishing our nation's founding father, Dr. Kenneth Kaunda, many happy returns as he turns 96 today. Indeed, his contribution to the health and wellness of the citizens of our nation continues to shine from generation to generation. Perhaps the best birthday present we can collectively give KK this year is to stand in solidarity with the guidelines that have been stipulated through the Public Health Act as directed by His Excellency President Edgar Chagwa Lungu, who is himself a champion of health and wellness. Let us continue to practice hand hygiene, keep our environments clean, wear masks when we're in public. Let us stay home and be safe and avoid crowding, and let us ensure social distance.